Hi, my name is Nicole Siegfried, and I am the Chief Clinical Officer at Lightfully Behavioral Health. We're going to be talking today about when to refer to higher levels of care. It can be very difficult as an outpatient clinician when you're working with a client to know when does my client need more than what I can provide. Today, we're going to help you determine when that is. A referral to a higher level of care is often needed when symptoms worsen or plateau. I like to think about it in three different areas. You're going to see that they're having difficulty in the area of regulation. And this is when distress really heightens and they're no longer able to regulate their emotions without assistance. And so outside of session, they may not be sleeping, they may not be eating, they may be having flashbacks, they may be self-harming. The second area I look at is what I call structure. Are they functionally impaired? Are they having difficulty creating structure in their life? So this would look like I'm having trouble going to work. I'm having trouble going to school. I can't get out of bed in the morning. I can't follow a schedule. I'm not going to my appointments. And then third, probably the most important area is safety. When clients at lower levels of care cannot maintain or create safety on their own, they may need a higher level of care where they have more frequent intervention and where we can create observations, rounding that keeps them safe until they can do that on their own. Make sure in these situations that you're trusting your instinct. When you feel in your gut that your client needs more, they typically do. Early intervention can really make a difference, so don't be afraid to bring it up to them as an option. The determination of the appropriate level of care starts with assessment. And what we're assessing is the client's level of functional impairment and their degree of severity of symptoms. The highest level of care that we offer at Lightfully is residential care. This is 24/7 observation for clients who have more acute symptoms or have safety needs that they can't provide in their home. The second level of care that we provide is partial hospitalization. This is somewhat of a misnomer because it's not at a hospital, but we also call it day treatment. This is where clients are able to come during the day for 6 hours or so to provide support, to provide group treatment, individual treatment, family treatment, psychiatric care, and then go home at night and practice some of the skills that they have learned in treatment. The lowest level of care that we provide is intensive outpatient. Here, the clients come 3 to 5 days a week, and they're here for 3 hours or so. So I like to say at this level of care that life is more important than treatment. Treatment revolves around life. People are getting back into school, back into work, back into their routine. At those higher levels of care, symptoms are at a place that they are severe enough that life needs to revolve around treatment. At IOP, I like to think of that as sort of flying the nest and having the support of treatment to fall back on. We also provide virtual services. So clients that are most appropriate for virtual services are those who may not be close enough to one of our in-person locations and clients that have more mild symptoms. When we make the decisions about the levels of care, we're always looking for the least restrictive environment possible. So if a client is coming to us from outpatient, we are going to look first at intensive outpatient or at virtual because it may just be that they need a step up. Now, if clients who are experiencing more severe symptoms, that may be an indicator that we need to start higher and work our way down. But this may be something that can be helpful to share with clients that will be looking at the least restrictive environment as a place to start. It's also important to know that we can shift among levels of care as needed. So if clients admit to a level of care that really isn't right for them, we can step them up if they need more, or they can step down more quickly if they really need less support. So this can be helpful in sharing with clients that they can try something out, and if it's not working, they can try something lower, or they can step up if something more is needed. It's important in discussing higher levels of care that you keep the therapeutic alliance at the heart. And so as part of that, you're going to want to be very transparent with your client of why they need a higher level of care and that it's not a reflection on how hard they're trying or their character or how hard you're trying or the type of therapy that you're providing. I use the analogy oftentimes of thinking about a broken bone. So sometimes you may, if you've broken your ankle, you start with a walking boot. And if that works, that's great. But you might need something more. You might need to go back if it's not healing, and you might need a cast or you might need physical therapy. And that's what we're doing here. It's not that the wrong treatment was provided or that they're not responding. It's that the wrong dose was provided and they need something more intensive. The other thing that can happen sometimes when you're talking about higher levels of care is that it can feel like you've given up on them or that you've abandoned them in some way. So it's important to be able to talk about coming back to treatment with you. That's where the majority of progress is going to be made, but we want them to be in a place where they can really benefit from the treatment you're providing. When you do refer to a higher level of care, you will be in contact with the team and with your client. So telling the client this on the front end can sometimes assuage some of those fears. You'll be sharing with the treatment team your recommendations in terms of what treatment will look like, and our team will be updating you on progress. That helps clients know that you're in the loop. At lower levels of care, you actually can still see your client. We actually recommend that because PHP and IOP can be an additional support on top of outpatient therapy. So you can get right back to work as soon as possible when clients are at a safe level of regulation where treatment is possible. Clients may experience ambivalence about going to treatment. And it is our job as the outpatient therapist to help them work through that ambivalence. So they may become defensive. They may demonstrate what we sometimes call resistance. Sometimes it's helpful to ask clients what would need to change for you to feel like a higher level of care was warranted. What would be happening in your life that you think would warrant a higher level of care? How would you know? Another thing that you can do is help them weigh the pros and cons of going to treatment. That's a good motivational interviewing technique of looking at the benefits and the drawbacks. Sometimes when our clients are paralyzed in the decision-making process, it can be helpful for us to walk along beside them. One is that we can take a step with them to call Lightfully or call a treatment center together. Sometimes just that first step can create enough momentum that they're able to do additional steps. Sometimes it's the fear of the unknown that really makes clients stop in their tracks. So a tour is something that can be really helpful to see where they're going to be going to treatment. Another thing that can be helpful is sharing client success stories. So if you've had examples of clients who've gone to higher levels of care and come back where you can then do the work necessary, this can be helpful for clients to really see hope that a change is possible. Self-care is essential when working with higher acuity clients. As people in the caring profession, we often put our own self-care on the back burner. It is essential when working with clients with more severe symptoms that this moves to the front burner. There are many ways you can do that. Sending someone to a higher level of care is one way because now you have another team that's working with you in treating this client. And so often it can feel very daunting. You can feel very alone in this process. When you send someone to Lightfully, as an example, you're going to have a treatment team that works with this client that now is a support for you. Secondly, you're going to want to have a consultation group. This can be very helpful when you feel alone, when you feel like you're just in your private practice by yourself. There's others out there that are also in private practice, and having a consultation group to discuss difficult cases, to provide support for one another just after a hard day can be something that makes a difference. The other recommendation that I have is keeping a variety of acuity on your caseload. When you start to see a lot of clients that are at this higher level of acuity, it's a signal that you may need to accept other clients into your practice with more mild symptoms, maybe offset when you see these clients on different days, and that is a way to stay more grounded. Referring to a higher level of care is an act of clinical wisdom and genuine care. It's important to remember that when we make decisions of sending a client to higher levels of care, that this creates better outcomes for the client and for ourselves. Thank you for the work that you do and for partnering with Lightfully to provide comprehensive care for those struggling with mental health. If you have any questions about the referral process, please reach out to our admissions team. We're here to support.